Well, I've spent days looking into the government's new hospital ratings, which came out in July. The two biggest hospitals in the valley got subpar scores. So I wanted answers to what caused this and whether any changes had been made. The ratings were surprising. St. Elizabeth's got 1 star, St. Elizabeth's Boardman 2 stars. The average score across the nation was 3 stars. Medicare's rating took dozens of quality measures and divided them into 7 categories, such as safety and timeliness of care, even patients who have to come back. St. Elizabeth's was below the national average in 4 of the 7 categories. St. E's Boardman in 3, and none were above the national average. Hospitals across the USA complained about different ways the scores were weighted, including one problem St. E's discovered, which Vice President Don Koenig told me about when I talked with him.
We had a lot of fields, more than I liked, that said no data submitted or no data available for this period. So that's also what we'll be working on, is making sure that we have the full data in the hands of the government in every one of those fields.
St. E's is licensed for 600 beds in Youngstown and 248 in Boardman. Koenig told me nobody lost their job over the ratings. The hospitals have been working with doctors and nurses to understand how they can improve patient and family experience, plus do follow-up with patients when they're discharged so they don't have to return. That includes at St. Joe's in Warren, which was a 4-star hospital.
All 3 of our hospitals scored very well as a good, high-quality, high-reliability hospital for the things that 95% of us need: heart attack, heart failure, knee and hip replacement, those sorts of things.
St. E's is challenged by seeing some of the sickest and poorest people in our area, yet it's always ready to handle every situation as a level 1 trauma hospital, which Don Koenig feels is more important than a star rating.
We are the major life-saving hospital in the entire valley. None of that has changed. We are still the preferred place for people to come with strokes, with heart attacks, because we have the whole team standing by ready to help. Please don't let that one-time, 1-star rating convince you that there has been a radical change.
Now, this was the first time Medicare issued the star ratings. Some of the data is updated quarterly, some is updated annually. St. E's has scored well in other rankings. U.S. News & World Report has the hospitals ranked in the state's top 20. Now, I've posted the list of all area hospital ratings, which I showed you at 5. You can find those at WKBN.com.